Hi, my name is Dr. Don Beasley with Boise Ear, Nose, and Throat, and today I'm here to discuss how to stop a nosebleed at home. So there's several techniques I want to talk to you about today. If they don't work, it's always a good idea to maybe go to the emergency room, but this will stop most nosebleeds probably 90-95% of the time if you just follow a few instructions here. First thing to remember, if your nose is bleeding, is to apply pressure. The way you apply that pressure is important. Your thumb and forefinger are your friends here. You want to just pinch the bottom half of the nose like this. From a side view, it looks like this. It's the collapsible part of the nose. It won't do any good to try to stop a nosebleed by pinching up here, holding pressure right here, or even putting ice on the nose. You just want to very simply collapse the bottom half together. Hold that pressure for about 5 or 10 minutes. If you let go and it's still oozing, you can always do that again for another 5 or 10 minutes. If the first measure doesn't work, the second thing you can try is Afrin nose spray. Afrin nose spray is an over-the-counter spray available at most drugstores and groceries, and you just squirt a blast of that up on each side of the nose, and immediately, again, use your thumb and forefinger, apply pressure. The Afrin nose spray is a very powerful constrictor of blood vessels. It's going to help it not to bleed. You combine that with the pressure, it's going to stop almost all nosebleeds. If those first two techniques don't work, the third option is to get a cotton ball. Cotton balls actually unroll. So you just unroll a piece of a cotton ball, just break off a little piece, and you just roll it up, squirt the Afrin nose spray on the cotton ball, put that little piece of cotton ball up inside the nose. It's better if you can determine which side is bleeding, but if you can't, you can just do both sides. Put the cotton ball up inside your nose, it'll feel kind of strange, and then you can leave it in there as is, or you can actually pinch the nose again with the thumb and forefinger with the Afrin soaked cotton ball inside the nose. Again, 5 or 10 minutes. If that doesn't work, it's still bleeding significantly, it might be time to think about going to the emergency room. Try one of these measures first before going to the emergency room if you can. These techniques will stop the vast majority of nosebleeds without going to the emergency room.